In layman's terms, a cesarean section is an abdominal delivery of an infant or child. It's really actually named after cesarean, which goes back to the Roman times. However, it actually predates the Romans too. It is thought that Caesar was born through the mother's abdomen, and hence the term cesarean. And there are different types of cesarean sections. And when I talk to my patients who are undergoing labor for the first time, I usually tell them there's 4 or 5 different ways that they would need a cesarean section. One would be if the fetal heart pattern is a non-reassuring fetal heart pattern, and we have to deliver the baby rapidly, then a cesarean section would be warranted. If for whatever reason the maternal's medical condition warrants a cesarean section, then obviously a C-section would be warranted. If a mother cannot deliver an infant vaginally, then a cesarean section would be warranted. And obviously if there are other extraneous circumstances during labor that warrant a cesarean section, such as her cervix not dilating, that would warrant a cesarean section. So those are acute instances at the time of labor that a cesarean section is warranted. However, there are other reasons for cesarean sections, such as malpresentation of the infant. If the baby is now in a breech presentation, we would usually do a cesarean section, although there are exceptions to the rule too. One of the greatest things or one of the controversies that we're talking about in our country today is vaginal birth after cesarean sections. And that has really created a little bit of a stir throughout our nation as to how many C-sections you can have and what type of cesarean section. One of the things that we worry about is what we call a vertical incision on the uterus, as opposed to a transverse incision on the uterus, and how you're allowed to undergo a VBAC or vaginal birth after cesarean section. I think those need to be discussed with their physicians individually and to be curtailed to their specific needs. The risk of C-section, obviously, with any surgery is infection and bleeding. Those are probably the 2 most common things that we normally see. Afterwards, subsequently, the second cesarean or third cesarean section may present its own specific complications, such as scar tissue that builds up. And as the scar tissue builds up, there may be more inherent dangers, such as other complications that would include dangers to injury of bowel and bladder, which are actually present and in the way at the time of cesarean section. So not only is there infection, bleeding, but also scar tissue that may ensue after other cesarean sections that may further complicate the procedure. I don't think that there's any physician that I know of, especially here in Zanesville, that takes any procedure lightly, specifically a surgical procedure, and especially a procedure that involves 2 lives, a mother and an infant. So careful contemplation and careful planning goes into place, not only with the physician but the team, to make the most safest route and the most expeditious route possible. Once again, I really am proud of the teamwork that we have here at Genesis, and with labor and delivery, specifically in our neonatal nursery, the pediatricians, the anesthesiologists, the nurses, and all of the personnel that make this happen. They make it happen daily, they make it happen safely, and they make it happen consistently. That's one of the things that I'm truly proud of. We have a level 2 nursery, which that means we can take care of sick babies. We also take care of high-risk obstetrics in collaboration with other institutions that we deliver here. And because of the teamwork and the expertise of the personnel, we make it happen.